Hello and welcome to AskDrOlsen.com. My name is Dr. Greg Olsen and I'd like to welcome you today. Let me tell you this, as you're visiting here, I'm here to help you. I am a wellness expert, and as a wellness expert, we focus on three main areas as the cause of your problems. Let me ask you a question. If there was something with regard to your health or your life that you could change, what would it be? Would it be that neck pain that's been giving you headaches and pain into your arms? Would it be that low back pain that's kept you from your activities and maybe in bed? Would it be that sciatica giving you pain down your legs? And could it be that carpal tunnel syndrome with pain, numbness in your hands? Is it that hypothyroid problem allowing you to be fatigued and sluggish? Is it your digestion? Whatever the problem may be, let me tell you, I'm here to help. As a wellness practitioner, as I mentioned before, there's three main areas that we look at. Let me tell you about them. The first area has to do with poor nutrition and chemical toxicity. With poor nutrition, that simply means the food that you're eating is junk and is causing problems with you. Chemical toxicity has to do with the fact that we're exposed to 82,000 chemicals. Between poor nutrition and the chemicals that we're exposed to, our body can become toxic and make it more inflammatory, painful. That's the first area. The second area has to do with hormone imbalances associated with chronic stress responses. Your adrenal glands are your stress response gland. The hormones that we're mainly talking about have to do with cortisol and DHEA. These are stress hormones. So when these hormones are out of balance, they can affect your body's ability to sleep, brain, your cardiovascular or heart health, your digestion, broad range of effects. So that's the second area. The third area has to do with hidden neurological damage. That mostly has to do with when you've been in an accident, in a trauma, done something in the past where your spine may have been affected, causing trauma or injury to the nerves. Maybe not with pain, but that is an area that we find. It's called hidden neurological damage. That's the third area. So with regard to these areas, and as being a wellness expert, let me do this. I'd like to invite you into the office to find out if I can help you. Very simply, that's because my purpose in practice is to help as many people as possible, and hopefully that next person will be you.
Hi, I'm Erica. I'm 47 years old. I originally came to see Dr. Olsen at the recommendation of my fiance, who was seeing him for some back issues and some other things. I was having trouble with hormones, perimenopause, hormones out of balance, just feeling out of control with that. And I was thinking of seeing a doctor that specifically dealt with that. And my fiance mentioned that Dr. Olsen covered all this stuff too, so I came in and had a consultation, and he let me know that he would be available to pretty much go over all of that and hopefully try to figure out what was going on with me. We did a whole lot of tests and got things under control pretty quickly. And I have to say that it's only been a few months that I've been coming, but I've noticed a big change and I feel a lot better. And what I love about Dr. Olsen is that he treats the whole person. I did have some issues with my neck, and we're working on that, but just all the other things that were going on and have just been helped so much. And I can't recommend highly enough if you are going through that, and I know a lot of women are, and it drives you crazy and makes you feel horrible. If you want to find out what's going on and do something about it and feel like you're past that point where you just are going nuts, you can come on in and see him, and he'll figure out a course of treatment that will work for you, and you'll be pretty happy in a pretty short amount of time.
Hi, my name is Ken Konecki. I have a background in sports and entertainment marketing. I also work with training athletes, NBA, college, elite high school, and grade school athletes. So to me, to be able to perform is very important. I came in here off a referral, and Dr. Olsen started taking more of a holistic approach. I came in here in very bad shape based on the foods I was eating and not really getting the proper care from a chiropractic standpoint that I needed. So when he diagnosed me with just doing some things that were a little bit outside of my sphere of understanding, I had to just have some trust and really bank on that he knew what he was doing. So I encourage you to just follow along the plan. He's helped me tremendously. I was in very, very bad shape coming in here, and within 4 months I felt results. Within 6 to 7 months I felt I was back up to par, really doing everything I wanted to do and moving forward and alleviating those things in the future based on my understanding of what he was doing over that time frame. So you ask why come in here and allow him to treat you. It's because he knows what he's doing. He's got a gift in that area, and I highly encourage it. And I'm now back, helping people through sports, entertainment, and just very grateful.
Hi, I'm Chrissy Meads. I came to Dr. Olsen after searching for a long time for a chiropractor who could help me. I was having issues with my neck being stuck and such, and just a lot of pain when I woke up in the morning, and really didn't think it was a big deal. I was referred to Dr. Olsen by another chiropractor who uses him and believes in his methods and techniques, and I was very intrigued to meet him and try him. And once I did, which it's been a couple months now, I have had such relief. I don't wake up in pain in the morning anymore. I'm able to play with my children and move certain ways that I wasn't able to before I found him. So I'm extremely thankful for Dr. Olsen and what he does and what he believes in.
Hello, my name is Willie Perry. I've been with Dr. Olsen for about 2.5 years, and I just wanted to share with you my journey with Dr. Olsen. When I first came to Dr. Olsen, I had neck problems and arm problems that were affecting my work and my ability to function at home. And from the very first moment of being with him, he was able to loosen that up to where I was able to function. Since then, he's had me on cleanses. I've lost weight. I've slept less, and I felt much better than I've ever felt before. But recently, I just had some test results that showed serious liver problems. And through Dr. Olsen's care, I've been able to get back on my feet, feel better, and I honestly think he was part of saving my life. So I'm very pleased with Dr. Olsen, and I would recommend him to anyone. Give him a chance and see what he can do for you. Thank you.
Hi, my name is Denise Kirkpatrick, and I've been a patient of Dr. Olsen's for several months now, and I'm doing this testimony because he has helped my neck hugely in other areas. But I came to him with grinding in my neck as I would turn it, driving in the car, turning to see if there was cars on either side of me. My neck would grind, and it was very uncomfortable sleeping at night. It would keep me up. And after seeing Dr. Olsen, he has taken all the grinding away, and we've started working on other things, which is great. And he has addressed many issues, not just the muscular and the bones, but he's also addressed some nutritional issues, and he is a fabulous chiropractor, not just in the chiropractic aspect, but also in looking at the whole body, using nutritional supplements as well as laser therapy. He has different modalities that he uses in the office, which I think gives him more tools to help the patients. And I'm happy to say that today I have no grinding in my neck, and that he has been very helpful in my whole body health.
Hi, my name is Pat Harkless, and I have been a patient of Dr. Olsen's now for a couple of years. In the past, I think most of us thought of chiropractic as somebody who pops your back or something like that, but times have changed a lot, and Dr. Olsen has quite a few technologies that I think most people are not aware of that I have found to be very helpful. For instance, about 5 years ago I started having breathing problems, and I went to 3 or 4 specialists, and no one tried to figure out why it was happening. They just said, here, breathe this strong chemical into your lungs twice a day for the rest of your life, and we'll hope for the best. Well, I wasn't satisfied with that. Dr. Olsen has a new technology, cutting-edge technology, where he uses a cold pulsed laser. And although we've only been working on this for a few weeks, I already have improved the capacity of my lungs to breathe and hold air and work properly. So it's very, very promising, and I'm quite excited about it. I've always believed that in spite of the fact that sometimes we do need drugs, most drugs have powerful side effects, negative side effects. So I always try to avoid drugs except when they're absolutely necessary. And I've been so pleased to find Dr. Olsen because he's so familiar with different methods of treating people, whether it's nutrition, whether it is basic chiropractic, kinesiology. He has been so helpful to me and to my family. My husband and my 3 sons have all been patients as well for various different things, and we've always been very pleased with our results. I feel that Dr. Olsen truly cares about his patients and is very, very anxious to help people, and that's a wonderful thing.
Hi, my name is Heather Gazelle, and I'm sitting here in Dr. Olsen's office today. I want to talk to you about some of my experiences with Dr. Olsen. I've been coming to Dr. Olsen for the past year. Originally, my mother started coming to Dr. Olsen probably about 8 to 10 years ago when my sister was a massage therapist here. And through the years, I've gone probably to, I don't know, maybe 10, 15 different chiropractors in my lifetime. And I have never really experienced what I've experienced with Dr. Olsen. I've been hurt by other chiropractors. Other chiropractors have been able to adjust me, however, they've never really been able to pinpoint why I was feeling the way that I was feeling. And Dr. Olsen really cares about your health and your life and your well-being, and that's one thing that's different about Dr. Olsen compared to the other places that I've gone. And my experience with him has been able to change my life and my future with my health, and I'm going to continue to see Dr. Olsen as long as I can.
Hi, my name is Dr. Greg Olsen. Welcome today. Today I'm going to be talking to you about discs in your spine, bulging discs, herniated discs, degenerated discs. Now, I've been in practice for 17 years, and in 17 years I've seen thousands of patients and hundreds of them with disc bulging problems, herniated discs, bulging discs, degenerated discs. A very common problem, something that dealt very well with the program that we do. So one of the first questions you may have is do I have a bulging disc? Do I have a herniated disc? Because I assume today that you're watching this because you have a concern. You have some pain in your spine, or you may have pain out in your hands or legs that you may be concerned is coming from your spine. So the spine has a set of nerve roots that come out from it. These nerves, right through here, each go out to a specific area. And the most common areas to get these bulges out where you're going to feel it would be the neck area and the low back area. And these areas that'll tend to go out to the arms and out to the legs. Now, when this happens, usually when a nerve root is involved, especially if it's just one that's going on, it'll have a very specific pattern. And that pattern, it can create pain or a weakness with you or a numbness that goes distinctly in one area out the arm, one area down the leg to a certain path. That's part of the questions that we ask when you come in, if you're having these areas, is where is it bothering you, what's specifically pointing out to it. That tells me clinically what nerve root may be involved with you. Okay? Now the nerves in the spine, they can provide sensory supply, which means feeling in the skin. They can also provide the muscular supply, meaning the muscles that make your body work. Okay? So that's also part of identifying what is happening with these. Now let's say we do find that you have a herniated disc, a bulging disc, or a degenerated disc. What do we do? Okay? I'm going to show you a little visual first. Pardon me as I reach for the model here. Now a little lesson in how the spine works. We all start off with a normal spine. Normal spine gets injured or damaged through either posture, an accident, falls, bike riding, skiing, whatever it could be. starts a process of degeneration, and basically the spine stops moving like it normally should. Now the disc in the spine requires movement. It requires normal movement in order to be able to feed the nutrients to that disc and keep it soft and spongy enough to where it's going to be a shock absorber for you. Now once that movement gets damaged, again from either a muscular pattern, a fall, or a trauma, that process of degeneration begins to take place. Now as it does, that disc begins to change. As that disc changes, it loses some of its height, it loses some of its elasticity, and then eventually in the next stage becomes in a worse state and becomes vulnerable to cracks and tears in it, that where that center area of the disc, called the nucleus pulposus, can actually start pushing out. Once it pushes out from the middle far enough, it can start causing that bulge. That bulge can then push out either into the middle, which may press onto the spinal cord, or more commonly out to the sides where it affects the nerve roots that we talked about earlier that go out to the different extremities or arms and legs in the body. So that's a little bit about how that process occurs. Now what do we do for it that's unique? Obviously, if there's a problem with a disc bulge or herniation or degeneration, it requires different types of work. One of the most common things clinically is to just take an area and focus on that one area. Say you've got a disc bulge in the neck. Okay, so let's get that area moving, and maybe let's do some decompression. Okay. Now those are all have the potential to be effective, but there's a couple of things that in my protocol found to basically improve that process. Number one is looking a higher place. That higher place is looking up in the cerebellum. I'm going to look over here for a moment. So all of these messages from the spine pass up here and go through the cerebellum. Cerebellum has a feedback loop that controls, for us, what's called balance and coordination, and also then controls these intrinsic or internal muscles in the spine. So if this is getting an abnormal message, it affects the spine. When the spine gets clamped down on, it begins that process of degeneration. It cannot move. That can irritate the facet joints that can get jammed together. It can affect that disc. No longer can it move properly, so it begins to get irritated and inflamed. And then that facilitates degeneration. That degeneration then facilitates that disc bulging. And unless you've done something like fallen out of a tree where you've had a serious compact or impact in that area. So one area, again, looking above, whether that disc problem is in the middle of the neck or in the low back area, is first area we look at is the cerebellum, and proper treatment towards addressing that and getting that working properly so the spine will move. So if we do address it in the local area, it will respond much, much better. The second area is I'm going to refer over here. There are times when we see that the muscles that are involved with this can be affecting it. From either one standpoint, those muscles may be tighten and spasm, limiting how the spine's moving. Part of that can be from the cerebellum. Part of that could be from postural patterns or old injuries that you've established. Okay, so that's a really key additional component. Being able to assess and address those deep intrinsic muscles within the spine, as well as the larger groups that move out from there. And then additionally, identifying what we call myofascial pain and dysfunction or trigger points. Many people, for example, will present with arm pain that seems like a disc problem, but it may be that nerve root being irritated from a scalene muscle or another area of entrapment out in these areas. That's part of the importance of differentiating what's happening with you rather than just going in and jumping in to treat one area. Doing a good exam, finding out what area is involved so we can properly treat you both on a local basis, neurological basis, and even a myofascial basis. So hopefully this has been helpful to you. We do get great results with people with disc problems, whether it be, again, with regard to the neck or the low back. So if you're watching this today for yourself, or if you're watching it for somebody else to get them help, that is our purpose. My purpose in practice is to help as many people as possible. So I'd be excited to help you or the person that you're watching this for. So please give us a call. My office number is 949-859-5192. And the website is AskDrOlsen.com. Thank you for visiting today. Hope I've provided some valuable information for you. And I look forward to seeing you or meeting you. Take care. Bye-bye.
Hello, my name is Dr. Greg Olsen. I'm here today to talk to you about fibromyalgia and brain-based therapy. It is a drug-free solution for neurogenic fibromyalgia, balance disorders, chronic fatigue syndrome, chronic pain, and headaches. Your nervous system is a vital part of your health. The spinal cord carries energy from the brain through the spine like a river to all the vital organs, tissues, and cells of the body. Each one is totally dependent on that energy to stay alive and stay healthy. In your nervous system, the key messenger system, or the chemical signal or neurological signal, is done through what's called neurotransmitters. The brain can't communicate with the gland unless there is a neurological connection and a chemical connection, and that is done through neurotransmitters such as dopamine, GABA, serotonin, and acetylcholine. From a neurological basis, when we look at what can be associated with or cause fibromyalgia, we look at brain function. In normal brain function, messages from your body go up through the lower brain stem, through the midbrain, to the cerebellum, cross to the opposite frontal lobe, and then feed back to the lower brain stem, providing what's called inhibition of the mesencephalon. The problem comes about when we get abnormal brain function. If one side of the cerebellum is not receiving the proper amount of nerve input, it cannot send the proper amount of nerve input to the frontal lobe of the brain. Then the frontal lobe cannot send the proper amount of nerve input to the lower brain stem, which will not be able to keep the mesencephalon from overfiring. So you're wondering, how did all this happen? When we look at the cause of these health problems, fibromyalgia, we look at three causes: chemical, physical, or emotional. Trauma causes a decrease in the brain's frequency of firing. Through the chemical component, that can come from poor nutrition or chemical toxicity, and the emotional component can come from chronic stress, worry, and concerns. When the mesencephalon is overfiring, the symptoms resulting from that disruption in the brain's electrical vitality can include chronic pain and chronic fatigue, migraine headaches, light sensitivity, blurred vision, increased sweating, difficulty falling or staying asleep, heart palpitations, increased heart rate, irritable bowel syndrome, urinary tract infections, high blood pressure, and fibrofog or flu-like symptoms. As this occurs, there are other areas of the brain that begin to malfunction as well. And with that, we can see episodes of depression, anxiety, difficulty scanning pages while reading, adding or subtracting, difficulty expressing what you want to say or understanding what others say to you. You can have a loss of short or long-term memory, loss of sensation or numbness, changes in handwriting. You can become more irritable or angry, develop problems with balance, tripping or dropping things, and experience learning disabilities such as dyslexia, ADD, or ADHD. So here we will begin explaining what happens with the overfiring midbrain. When the midbrain is overfiring, there are a multitude of symptoms that will begin to express themselves throughout the body. As you can see here, you begin with light sensitivity, migraines, heart racing, constipation, diarrhea, chronic fatigue and fibromyalgia, urinary tract infections, insomnia, and fatigue. The overfiring midbrain affects what's called the oculomotor nerve. That causes the pupil to stay wider. More light comes in, creating a light sensitivity. The overfiring midbrain also affects the blood vessels in the brain, causing them to dilate. That nerve mesh around the blood vessels becomes irritated, leading to migraines. The overfiring midbrain also causes a part of the brain called the medulla to not receive proper stimulation. And with that, that affects what's called the nucleus tractus solitarius, leading to vagus nerve inhibition and constipation and diarrhea, and also inhibits urination, getting stasis of the urine, leading to urinary tract infections. Additionally, overfiring of the midbrain leads to mesencephalic reticular activating system being overactive. The highest firing rate is at 3 a.m. Get high cortisol and what's called an adrenal stress index. That leads to insomnia. The lowest the firing rate is at 3 p.m., that leads to fatigue. The overfiring midbrain also goes down the spinal cord through the intermediolateral cell nucleus, contributing to effect with the heart through the SA node and AV node, leading to heart racing or palpitations, also leading down through the spinal tract to the adrenal medulla, causing release of catecholamines, norepinephrine into the bloodstream, activating the type C nociceptive pain fibers, contributing to chronic pain and fibromyalgia, then leading to fatigue due to a loss of sleep. With emotional stress, that causes the hypothalamus to release corticotrophin releasing factor, which goes to the pituitary, causing it to release ACTH, which causes the adrenal medulla to secrete cortisol, which is toxic to the brain. So with cortisol reaching the brain, things you can experience can be memory loss, problems focusing, and in the classic picture what's called fibro fog. What you likely have already discovered is that fibromyalgia does not get better by itself. It's been found that the longer you have fibromyalgia, the more and faster your brain dies. The Journal of Neuroscience reports that the McGill University Center for Research on Pain has found that, quote, the longer the individual has fibromyalgia, the greater gray matter loss, with each year of fibromyalgia being equivalent to 9.5 times the loss of normal aging, quote. In addition, it is estimated that 30 to 60% of patients diagnosed with fibromyalgia become disabled to the degree that they cannot remain gainfully employed, and that is with the myriad of medications prescribed. The next topic is neuroplasticity. What's been found that of all the finds, though one is rewriting the textbook, is the dawning realization that the brain, as it gets older than 3 years old, is not the rigid structure that scientists long thought, but it is actually malleable. It's a plastic organ. But a flood of discoveries show that the brain continually reorganizes itself. It's called neuroplasticity, and it means that you create your brain from the input you get. So you may be asking, how is brain-based therapy different? Brain-based therapy is consisting of a comprehensive neurological and metabolic workup. So many times in evaluating people with fibromyalgia, a couple of these tests may be done, but doing a complete neurological and metabolic workup is the key to finding the multitude of malfunctioning body systems to get results in treating fibromyalgia. One example of a test that is done on a metabolic side is the adrenal stress index for cortisol levels. So on the left slide, you can see in between the red lines is the normal patterning for cortisol levels, highest in the morning, tapering off through the day. In the white line there, you can see that this particular example, the cortisol level has gone up and spiked during the evening, and that contributes to insomnia and likely later issues in the day of factors related to short-term memory loss, fatigue, fibrofog. On the right side, it's a display of what's called the inducers of cortisol release. 4 key factors we look at for cortisol release: glycemic or blood sugar dysregulation, tissue damage, which can include inflammation or pain, sympathetic overflow, and also mental or emotional stressors. The neurological treatment of fibromyalgia and chronic pain consists of treating cerebellum and brain dysfunction. The cerebellum and brain require 2 things in order to function properly. Number 1 is fuel, which consists of glucose and oxygen. Number 2 is activation, which can include what we call unilateral or one-sided adjusting or manipulation, and brain-based rehabilitation. Some of the therapies used for brain activation include vibration or percussion therapy on one side of the body. It can also include gentle chiropractic adjustments or manipulation on one side of the body using either an instrument called an arthrostim or another instrument called an activator. Therapies that are used for brain activation. This can include the upper body ergometer, and this therapy is done while using an oxygen concentrator. It's called exercise with oxygen therapy. Additional therapies used for brain activation can include auditory stimulation in one ear or auricular stimulation in one ear using an electroacupuncture device. Continuing, more therapies for brain activation can include warm caloric in one ear, stimulating the inner ear hair fibers. Also, olfactory stimulation in one nostril. Additional therapies used for brain activation can include visual stimulation in one eye, using small letters that make up a big letter. This is an example of looking at neurological fibromyalgia with metabolic complications, such as hormone imbalances caused by stress, blood sugar dysregulation, oxygen deficit, midbrain neurological misfiring or malfunction, cortisol elevations or depletion, and cerebellum misfunction. Success with fibromyalgia involves correcting the brain misfiring and metabolic dysfunctions. An essential part of a treatment program is periodic retesting to let us know that we are on the right track. Through this comprehensive approach of looking at the neurological and metabolic components of fibromyalgia, it brings together all the pieces and treats the whole person. Recommended actions from today's presentation. Number 1, make an appointment for an evaluation to see if you qualify for a brain-based neurological treatment program. If you'd like more information, you can contact or visit AskDrOlsen.com, or you can reach the office at 949-859-5192. One of the things I found in my years of practice is that without action, you can't get results.
Hi, my name is Dr. Greg Olsen. I'm here today to talk to you about sciatica and sciatic nerve pain. I've been in practice for over 17 years, and in that time I've become an expert in treating sciatica and sciatic nerve pain. Now, I've seen thousands of patients, hundreds of which have had sciatic pain. Now, if you're listening to this today, you or someone you know is likely concerned that you have sciatica or sciatic nerve pain. Most likely you have pain in your buttock, down your leg. Where sciatica comes from is an irritation to the nerve roots that are in the 4th lumbar through 1st sacral areas in the spine. One of the things that we found to be most essential in this is, first off, identifying if it is really sciatica. Now, the sciatica nerve comes from those areas in the spine. They come together and they form 2 different nerves. They come together, the common peroneal and the tibial. Now, when those come together, they will provide innervation into the buttock area, the muscles of the back of the leg or the hamstring, the muscles in the back of the leg and sensory, and to the top of the foot and the bottom of the foot. What this means is, if you have leg pain that's going down the back of your leg, if you have pain in your hamstring area, that does not qualify as sciatica nerve pain. In my experience, most of the time, that is something called myofascial pain and dysfunction, which can come from any of these gluteal muscles in the area. We'll come back to that in a little bit. With sciatic nerve pain comes from the spine, and we have a nice diagram here. So with the spine, the areas that we're talking about are the 4th lumbar, 5th and 1st sacral and 2nd sacral nerve roots. What happens is, if you can see right here, the nerve roots come together and this forms a sciatic nerve. The sciatic nerve then passes through this notch here. On this side, you can see the muscles here. So we have several areas where the sciatic nerve can get involved. One, a problem in the spine, degeneration, a disc bulge, and following it down lower, we can have a problem through here. The sciatic nerve will pass either under or through or over this piriformis muscle. So if there's irritation through this area, that can also cause sciatica and sciatic nerve pain. So those are the key areas that we look at. With the sciatic nerve, It produces pain, again, in the buttock, calf, and the foot. You may experience numb feelings, weakness, tingling. Your leg may actually get weak, unable to support you. Those are all indications that there may be sciatica nerve pain. Again, pain in the back of the leg or the hamstring is not sciatic nerve pain. That is more typically either a different nerve root or a myofascial pain and dysfunction. So part of what we do from a specialty standpoint in treating sciatica is first off discovering if it truly is sciatica, and then secondly looking at what's happening in these areas where it may be involved. When we look at the spine, first we look at to see, is there a problem with degeneration? Is there disc bulge? Is there disc herniation? Is the spine able to move? Are those discs able to work properly? When we move up from there, as far as the spine moving properly, then we need to look up in this area. The spine has a great deal of control from a structure up here called the cerebellum. The cerebellum controls balance and coordination, also controls the intrinsic muscles in the spine. So when we have a problem with the cerebellum, that can cause the spine to lock up. Those discs are not able to move, causing irritation, inflammation around those joints, facet syndrome, disc herniation, disc bulge. So one of the key concepts that we look at that differentiates us is this neurological component where we look at that cerebellum function, actually brain function, how that controls the spine and it relates to these areas. Then additional to that, focusing locally to see how the spine is working. Again, if it's a facet syndrome, if it's a disc bulge, addressing those locally as well as higher up and neurologically. As I mentioned before, it's not always sciatica. There are times when this pain is actually produced from what's called myofascial pain and dysfunction. If you can see from this diagram here, this can produce pain that very commonly is mistaken for sciatica, and that'll go right down the back of the leg to the back of the calf. The sciatic nerve very simply doesn't provide any sensory innervation to the back of the thigh. So if that is happening, then we know it's not sciatic pain. Now, again, today if you're watching this, you're likely either suffering from leg pain yourself or somebody you know. My purpose in practice is to help as many people as possible. So if I can be of service to you and help you or somebody that you're watching this for, then please give my office a call, 949-859-5192. We'd be happy to help you out. Or you can visit my website at AskDrOlsen.com and find out more information and how we can help you. Have a great day. Take care. Bye-bye.
This presentation is about how to stop the pain of peripheral neuropathy. My name is Dr. Greg Olsen. I am a doctor of chiropractic. I am board certified in applied kinesiology, practicing functional diagnosis and functional neurology. I have over 300 hours of postgraduate education, and most importantly right now is I belong to a member of nationwide doctors, over 1,000 who are dedicated to helping chronic conditions, including peripheral neuropathy. First in this presentation is to discuss what is peripheral neuropathy. Peripheral neuropathy is a problem with the nerves that carry information to and from the brain and the spinal nerves. When this happens, it can produce a pain, loss of sensation, and inability to control the muscles. Very simply, peripheral means further out from the center of the body. It's distant from the spinal cord and the brain, whereas neuro means nerve and pathy means abnormal or diseased. So if you're wondering if you have peripheral neuropathy, the 7 key signs or symptoms of peripheral neuropathy include numbness, burning in the feet, cramping in your muscles, sharp electric-like pain, pain when walking, difficulty sleeping from leg discomfort, prickling or tingling feelings in your legs or your hands. So what happens is the symptoms you experience really depends upon which type of nerve is affected. There are 3 main types of nerves. There are those nerves that are sensory. They carry sensations such as touching and feeling. There are the motor nerves, or the nerves that control muscles. And then there are the autonomic nerves, and these control the organs and glands. When we look at the first set of nerves that can be involved, the sensory nerves, this produces sensation changes. So damage to the sensory fibers results in changes in sensation. It can be burning sensations, nerve pain, which can be the electric-like pain, tingling or numbness. It can also produce the inability to determine a joint position or where your body is positioned at, and this can produce incoordination. For many neuropathies, these sensation changes often begin in the feet and progress towards the center of the body with involvement of other areas as the condition worsens. Diabetes is one of these common causes of sensory neuropathy that can happen in the feet and the hands. Another one, a couple different names are sciatica and also carpal tunnel syndrome. Those are some common ones that you may recognize the names of. When the motor nerves are involved, this can produce movement difficulties. So damage to the motor fibers interferes with muscle control, and this can cause weakness, loss of muscle bulk, loss of dexterity. Sometimes cramps are a sign of this is going on, that there's motor nerve involvement. There are other muscle-related symptoms that can be involved. These include difficulty breathing or swallowing, difficulty or inability to move a body part. It can be paralysis or partial paralysis. It can be falling from legs buckling or tripling over your toes, not knowing where your legs are from that nerve damage with the muscles. A loss of dexterity. This can include such as being unable to button a shirt or tie your shoes. Lack of control of your muscles, loss of muscle tissue or muscle atrophy, muscle twitching or cramping. Now, the third category of nerves that can be involved are the autonomic nerves. These control the involuntary or semi-voluntary functions such as control of internal organs and blood pressure. Damage to autonomic nerves can cause things such as abdominal bloating, blurred vision, constipation, decreased ability to sweat, diarrhea, difficulty beginning to urinate. It can also cause dizziness that occurs when standing up or fainting associated with a fall in blood pressure. It can cause you to feel full after eating a small amount of food. It can cause a feeling of incomplete bladder emptying, heat intolerance with exertion, male impotence. It can also relate to nausea or vomiting after meals. It can also produce unintentional weight loss, more than 5% of your body weight. It can also produce urinary incontinence. These are all signs that these nerves that are controlling your body's functions are not working. Now, you may be wondering what causes neuropathy. There can be a variety of causes associated with this. The first one we're talking about here can be a physical cause. This one can be such as previous traumas to your body. Example is I hurt my back years or decades ago. This can lead to scar tissue, arthritis. There can be spinal stenosis, or where the openings close down on the spinal nerves or the spinal cord. It can be a bulging disc. Additionally, we can look at chemical causes such as statin drugs. Those are commonly used to control cholesterol. Diabetes, type 1 or type 2, can be also associated with poor diet. And there are times where we look at genetics, can be associated with it. In general, though, what it looks at is about 80% lifestyle contribution and the 20% genes contribution when we look at the genetic component. So you can see as time goes on, older people have a definite decreased potential to make ATP to begin with, and then taking these statin medications, which suppresses their ATP production to a point which the neurons cannot maintain their electrochemical gradient, or basically speaking, their health. The frequency of firing, which is how these nerves work or how they fire, will decrease, and then this is perceived by the brain as numbness and tingling, just depending upon the exact fiber that is affected. We also talked about diabetes and how that can be a source of neuropathy. When we look at diabetes, we look at insulin. And insulin is a hormone produced by the pancreas to control blood sugar. In diabetes, that can be caused by too little insulin, insulin resistance, or it can be caused by both. Ultimately, this problem with insulin affecting the ability for cells to work properly can lead to diabetic neuropathy in the lower extremity of the feet or the upper extremity in the hands. One thing that we've discovered in working with this group of over 1,000 doctors nationwide in looking at resolving chronic conditions, including peripheral neuropathy, is that all these chronic health conditions seem to have some common elements to them, whether it be fibromyalgia, peripheral neuropathy, or vertigo, or sciatica, rheumatoid arthritis, chronic pain, irritable bowel syndrome, insomnia, or digestive disorders, the common things that we see are oxygen deficits, neurological misfiring, metabolic imbalances, including the blood sugar, cortisol, hormones, anemia, and autoimmune attacks on your body, and brain imbalances. One of the key components of these chronic conditions, including peripheral neuropathy, is getting a solid lab test, or a good series of lab tests to see how your body's working. One thing that happens with this is many times we'll get lab tests and they'll look like they're all normal, or you have been told that they're all normal. So what we see is lab ranges have a very broad range. Some people say they're inaccurate simply because that bell curve is used, and it creates a very broad range. We look at what's called functional lab values, and this is a tighter, more optimal range to see, well, basically they're more sensitive to reveal problems that are developing or in the early stages. Now, these are some examples of how lab ranges can vary. For example, blood sugar, laboratory range may be anywhere from 65 to 110 before there's an indication of a problem. In our functional components, we look at a range from 85 to 100. If it's below 85, it can be an indication towards hypoglycemia. Another example is TSH, or thyroid stimulating hormone. And what happens in this situation is the laboratory range you can see is from 0.3 to 5.7. It's a huge range, and really prevents the identification of some problems that are going on. In a functional range in that measurement, we look at 1.8 to 3. And so in this situation, if the test result was 4.2, it would tell us that there is a hypothyroid situation that's going on. And it's very key to be able to address that problem, to address your problems. And next up is looking at cholesterol. In the cholesterol range, laboratory ranges usually look at under 200 as optimal. In the functional category, we look at 150 to 200. So if you had a reading of 148, you might be told that that's a great reading. But from a functional standpoint, that would tell us to look at some connections that may be happening, including what may be a hormone imbalance. So in order to effectively address some serious and chronic conditions, including the peripheral neuropathy, comprehensive neurologic and metabolic workup is very appropriate. You can see from the neurological test, we would do right and left blood pressure, tissue oxygen, checking heart rate and rhythm, including heart rate variability, saliva pH, reflexes, eye tests, cranial nerve testing, and cerebellum testing. From the metabolic testing, including blood sugar levels, your adrenal function and cortisol levels, thyroid hormones, and also looking at your immune system through the presence of different antibodies, including the cerebellum, the thyroid, also looking at the hormone panel, female hormone panel if you're a woman, a male hormone panel if you're a man, and looking at food sensitivities. And last on that category, which many times is the most critical, is looking at the immune panels. So as part of a comprehensive and neurological and physical examination, that ensures an accurate diagnosis to make sure that your treatment is most directed at what's going to get you better. So when we look at one component of a treatment program, this on a neurological basis, when we look at treating the cerebellum and brain dysfunction, they basically require two things in order to function properly, fuel and activation. Fuel requires glucose or blood sugar, and then oxygen. For activation, this is looking at where the signals are deficient that are being fed up to the brain. And this could, to stimulate this, can include unilateral or one-sided manipulation or movement of the spine and body, and also what we call brain-based rehabilitation. An additional very innovative and cutting-edge approach that we use is using what's called laser therapy. Laser therapy, we use the MR4 system in our office. It's great for patients that have chronic nerve damage. When we talk about physical causes of peripheral neuropathy, these can include herniated discs, bulging or protruding discs, degenerative disc disease or posterior facet syndrome. You may experience sciatica. These are conditions in which we use a physical treatment called non-surgical spinal decompression. What we use is called the Triton DTS, and have very good success with regard to working on this component of peripheral neuropathy. This is one example of a functional adrenal test. It's called an adrenal stress index, and this is where we look at one part of the metabolic component. This is where your cortisol levels can be measured from throughout the day to identify what stressors may be occurring. Could it be glycemic dysregulation, tissue inflammation or pain, emotional stressors or sympathetic overflow that's relating to this cortisol? So ultimately, when we look at peripheral neuropathy and we look at the connections between metabolic and neurologic, we look at the hemisphere in the brain misfiring and with the metabolic complications. These are the different pieces of the puzzle that we have to look at: the cerebellum, the cortisol levels, oxygen levels, blood sugar, hormone balance, and midbrain functioning. So the key to successful treatment is correcting the brain misfiring and the metabolic dysfunctions. This is perhaps one of the most important elements of a successful treatment program, and this is retesting. Retesting lets us know that we're on the right track and achieving the right results. And this is separate from symptomatic improvement, which typically follows this, but the actual objective findings found with retesting is very key. Our success comes by treating the whole person. We bring all the pieces together at the same time. So you may be asking, what now? This information is great, but how do I use it? How do I find out if it can help me? Well, if you or someone you know has peripheral neuropathy or other chronic health condition, and you want to know if this brain-based therapy is right for you, very simply schedule a BBT screening. It consists of 12 screening tests. You can reach us at 949-859-5192. If you would like additional information, please visit my website at AskDrOlsen.com. Again, my name is Dr. Greg Olsen. It was a pleasure to speak with you today.